Hi, everyone, and thanks for joining us during this half hour. Is it caution or alarm? This week, our region saw a huge uptick in the number of COVID cases driven by really the wild spread of the Delta variant.
And as local leaders increase COVID alert levels across our area counties, we're spending the next half hour with some experts who are here to answer some of the questions we consistently are hearing from you, our viewers, about the virus, about the vaccines, about the various risks that different groups face as the virus reaches levels similar to last summer, despite half the population being vaccinated. Again, looking at those numbers right now across Texas, the 7-day average for new cases is above 9,000 per day, which is on par with where we were last summer. And the state has more than 8,000 COVID patients in hospitals, which is very close to the rates we were seeing last summer when the governor issued an order suspending elective surgeries to prevent hospital capacity issues. Now, he has not done the same yet this year, but it is being reported that 99% of those hospitalizations are people who are unvaccinated against the virus. With Texas sitting at only a 52.5% vaccine rate, that means about half the population is bearing nearly the entire brunt of this current rise in cases.
Well, Caitlin, as the state reports a nearly 17% positivity rate for the virus, the Texas Medical Center is reporting that we are sitting right here at 13%, but that number needs to work its way back down below 5% for more than 14 days to indicate community control. So as we look into the increase in the cases and hospitalizations, we are starting tonight with your questions for Dr. Peter Hotez, who is the Dean of the National School of Tropical Medicine at Baylor College of Medicine and co-director of the Center for Vaccine Development at Texas Children's Hospital, and a very familiar face to us in the last year or so. Dr. Hotez, thanks for joining us.
Thanks for having me. Happy Friday.
All right, happy Friday to you, but we're going to get right to the questions from our viewers. First, coming from Robert asking, why does the spread of the Delta variant seem so alarming? It doesn't seem to be as deadly as the first one.
It is a very serious virus, and the reason we're not seeing as many deaths is because we've done a good job vaccinating older Americans. About more than 80% of older Americans over the age of 65 are vaccinated, although it gets up to 99% in the Northeast, so we're not doing quite as well. Where the bottom falls out are among young people. So across the South, we're seeing fewer than 20% of adolescents vaccinated, as opposed to over 70% in the Northeast, and not doing much better among young adults. So that's who's going into the hospital now. So we're seeing a lot of sick people, and the problem, of course, is this Delta variant is the most transmissible of any of the variants we've seen before, 2 or 3 times more than the previous ones. And the CDC director, Rochelle Walensky, recently announced that it's as transmissible as the chickenpox virus, varicella, which is one of the most transmissible viruses we know. So the upshot of this is pretty much anyone who's not vaccinated by this time is now at high risk of contracting the Delta variant because of that high transmissibility. And that's why we're seeing this rapid ascent.
Yeah, and Dr. Hotez, that leads perfectly into the next question that we got from Selena asking, I never got COVID the first time, so is it necessary for me to get the vaccine?
Yeah, now more than ever. In fact, you're running out of time because, remember, it takes time to fully vaccinate. If you're getting either the Pfizer-BioNTech or Moderna vaccine, 2 doses. You get the first dose tomorrow, which you should if you have not been vaccinated. The second dose 3 or 4 weeks later. Then it's a week or 2 after that before you achieve full protective immunity. So you're 5-6 weeks away to being fully protected, and now the virus is sweeping through. So it's not too late, of course, but the longer you wait, and now the schools are opening here in Houston in a couple of weeks, 2-3 weeks, and then across the South, you definitely want to get your adolescent child vaccinated if they're over the age of 12.
Well, Dr. Hotez, that was a question from Selena. She said she never got COVID, but Brenda had this question because she says if a person got COVID already, why does that person now need to get vaccinated?
And that's because the level of protective immunity from infection and recovery is highly variable. In some cases, there's not much protection at all. So by getting vaccinated on top of previous infection, it turns out we have studies now showing that may be the most durable protection of all, and has a lot of resilience against the variants. So if you've been infected and recovered, definitely get vaccinated, and then you'll be in pretty good shape. And if you don't get vaccinated, you're at risk of reinfection.
We have another question, Dr. Hotez, coming in here from Alicia, who says, how quickly can we or should we be watching for other variants to rise up? Will the current variants or vaccines rather work on them? I know we've heard about Lambda, we're hearing Delta Plus, so we're starting to hear about changes, but how concerned are you until we'll see something else that's going to pose a major threat?
The reality is right now Delta is a major threat. It's probably one of the worst threats we've faced in terms of COVID-19. So, I mean, I can answer questions about other variants, but Delta is a bad actor, and you definitely want to get vaccinated against that. There's seems to be good levels of protection in terms of symptomatic illness and keeping you out of the hospital, so get vaccinated. We are watching other variants, and remember why these variants come in and spread. It's because we're incompletely vaccinating the population. If we had fully vaccinated, if we had, Caitlin, if we had the same level of vaccination here in Houston as we have in Vermont right now, we would not be having this discussion, and that's the reality. So, we've got to fully vaccinate the population, and that means 80-85% of the population to fully vaccinate to stop transmission. And because kids under the age of 12 are not eligible to get vaccinated, effectively that means all of the adults and all of the adolescents. You might scoff and say, oh, that's not possible. Well, it is, and that's what's happening in Vermont and Massachusetts and states up in the Northeast. We've got to reproduce that.
All right, Dr. Hotez, hopefully you'll stick around. We have a few more questions for you coming from our viewers. We appreciate you. We're going to take a quick break and more with Dr. Hotez right after this.
Thank you for staying with us as questions continue to come in. So we have Dr. Peter Hotez joining us again to take more. And Dr. Hotez, I want to talk about those who are hesitant about the vaccine because of health conditions that they already have. For example, Garza asking us, saying, I have lupus. Do you recommend I get the vaccine? Saying, is my immune system too low?
No, well, what we do know is people who are on immunosuppressive therapy, meaning solid organ transplants, some cancer chemotherapy individuals, bone marrow transplants, CAR T therapy, they often do not respond as well to 2 doses of the vaccine as we'd like. And now the FDA and CDC are in discussions about recommending a 3rd immunization for those individuals, and there seems to be some added benefit in terms of virus neutralizing antibodies. For something like lupus, they should be able to respond well to the vaccines, but this is a good opportunity to have a discussion with your rheumatologist if you're followed by a rheumatologist, but you definitely are at risk of getting severe COVID, particularly if you're receiving any kind of immunosuppressive therapy such as steroids or some of the immunosuppressive drugs they use with some individuals with lupus, and so you are at risk. And of risk of getting sick and from severe COVID, and all the more reason for you to get vaccinated.
Dr. Hotez, Taronda also wrote into us saying that I tested positive for COVID in May. I was told I can't take the vaccine for 90 days, which is August 14th. Do I still need the vaccine even though the antibodies are still in my system?
Well, it's not so much that you can't get vaccinated. It's just that you're probably at lesser risk of reinfection. And during the time when we were worried about having enough vaccine available, that was recommended that you wait that long. But it's probably okay to get vaccinated now in order to go ahead. There's not a specific magic number appended to that 90-day period.
We have another question here tonight, Dr. Hotez, from Naomi, and she's asking, after having COVID, how long will you test positive without any symptoms?
It really depends, and it depends on what kind of test you do as well. So if you're doing a PCR test, that becomes negative fairly quickly because that's measuring active amount of virus in your nose or mouth. If you do an antibody test, it depends partly on the severity of illness. So people with mild or asymptomatic illness often have rapidly declining levels of antibodies, not always, and as opposed to those with more severe illness. So it's highly variable, and one can't really predict until you actually try to measure it. In either case, it's not all that instructive. You still need to go ahead and get vaccinated.
A national leader in immunology from Baylor College of Medicine, Dr. Peter Hotez, thank you so much for clearing up some of the many questions we continue to see people have even a year and a half into this pandemic.
Thanks so much, Caitlin.
Well, stay with us tonight. Many of you want to know, how safe will my child be going back to school with or without a mask mandate? We've got your answers coming up next. Well, we now know that the Houston Independent School District is considering its own mask mandate and is planning a school board vote next week to require masks for students, staff, and campus visitors. That's despite Governor Abbott ordering that schools cannot require face coverings.
And joining now to discuss concerns about our children is Dr. Manish Kumar with Kumar Pediatrics and Harris County Medical Society. Appreciate you being with us. Obviously, we know those under the age of 12 are not eligible for vaccines at this time. And Christina mentioned to us in our comments that she's extremely worried about sending her 11-year-old to school this year, asking how safe can the school actually make it for kids?
Yeah, so schools can only be as safe as we demand they be. There are some obvious common sense approaches that we can take. We know what works so far, regardless of what variants we face. Masking helps. We can make sure we send our kids to school with masks on and hope that teachers and staff in schools do the same. For those kids that are old enough to get vaccines, we want to do everything we can that we can ensure vaccination of the largest portion of the population as well. And then distancing and precautions in the classroom really worked.
Now, cases of COVID for children were relatively rare compared to the overall caseload that we saw so far in the pandemic, and relatively mild. But Joe asks, how much worse for children is the Delta variant that we're seeing compared to the previous strains?
Spread with less efficiency in the prior 12 months, but what we've been seeing in the last few weeks is that the Delta strain is really a lot more efficient at spreading amongst children. My concern is as our kids go back to school and they get cohorted together in relatively small spaces, if we compromise the common sense precautions of vaccination, masking, distancing, hygiene precautions, that we will see an even more rapid increase of transmission of infection.
Dr. Kumar, we also have a question tonight from Meredith, and Meredith is asking, how long does long COVID affect children, and how many are getting it right now?
Yeah, that's a very good question, and that's a subject that we're still learning an awful lot about, either from the Alpha and now the Delta variant. There are studies from across the world, United States included, that indicate that upwards 10, 15, maybe even 20 or more % of kids may have some measure of long-haul symptoms. But this is something that we'll really only learn in retrospect.
Sharonda also wants to ask you tonight, do vaccines pose risks to children 12 and up? And when will children under 12 be eligible to get the vaccine?
Vaccines pose no known significant risks that we've been able to identify so far. The risk versus benefit weighs greatly in favor of the benefit of vaccination. As far as when we'll be able to vaccinate children younger than 12 years of age, those studies are in the works, and we hope that they will be able to prove the value of vaccination of younger children sooner rather than later.
And Jonathan also wrote into us asking, wanting to know, how contagious are unvaccinated children who catch the Delta variant?
From what we can see so far, it seems that children picking up the Delta variant may be as much as twice as contagious or as infectious with prior variants that we've seen. So those precautions that we know of that work, we need to do them. We need to do them consistently, and we need to keep our kids and our families safe.
All right, and our children have been through so much as they try to learn along with us and follow our leads. We appreciate having leaders like you and doctors like you, Dr. Kumar, who can help us understand what we can be doing best as parents to guide them forward through this. Thank you for joining us.
You're welcome.
Much more to come tonight on our Delta variant Q&A special. We're joined by a doctor for some myth busting on vaccines, including some questions that a lot of people have about fertility. All right, welcome back everyone to our special here tonight. We are continuing to talk about a lot of the questions and misinformation that a lot of you have been seeing circulating about COVID-19 vaccines. Are they safe? And how effective are they against the virus? Joining me right now is Dr. Michael Gwynn, Associate Professor of Internal Medicine at UTMB. Dr. Gwynn, thanks for being here. We'll jump right into this tonight. We're getting a lot of questions from our viewers about some of the misinformation. Eduardo says that he has a relative working in the medical field. He goes to various hospitals and won't take the vaccine because he's noticed that many of the people who've been hospitalized have been people who are vaccinated. And so he's asking, with all the conflicting reports between the studies that are out there, the personal accounts, how does someone explain the contradictions, and why should someone take the vaccine?
Well, what we are realizing is that the Delta variant is very transmissible. As Dr. Hotez was talking about, the viral load for the Delta variant is very high. What we do see is that persons who are vaccinated typically are not hospitalized at high rates like the unvaccinated. And also, even when they contract the infection, their symptoms are not nearly as severe. So, we didn't take account for these variants, but we do still see that the vaccination rates are helping reduce hospitalizations.
And Dr. Gwynn, one of the big questions coming from a lot of people, particularly women, with no long-term data out there, how do we know it doesn't cause fertility issues? We're talking about the vaccine, of course, here.
Right. Well, for both men and women, the CDC, along with the American College of OB and Gynecologists and the Society of Maternal Fetal Medicine, all three groups, all three major health organizations, have found no significant evidence of either male or female infertility, and all three recommend vaccinations. Granted, we only know about this disease for only about a year and a half. But we do have good strong evidence that there is no fertility problems at this moment.
And Georgie is asking tonight, is it possible that the Delta variant is a virus mutation coming from those who are vaccinated?
That is unlikely. Variations come naturally. One supportive evidence against that is that the Delta variant was first noticed, I believe, in early December in India. That's well before the mass vaccinations that were occurring in January this year. So the variant was already around before mass vaccinations were occurring.
Kevin C. wants to know, won't COVID vaccines weaken your immunity?
Absolutely not. Quite the contrary. Those that are immunocompromised or have a weakened immune system should highly consider getting it. I have not known about anyone who has gotten the vaccine and became deathly ill from it. I can add to that. I have many colleagues that were part of the phase 3 trials late last summer, and they are doing fine. I received my vaccines in December. I'm doing fine, and so that's definitely a myth.
Isabel is asking tonight, is it safe if I'm breastfeeding?
Yes, according to the CDC, it's safe as well. So there's no problems there.
And a question we continue to get, like this one from David. If you were already infected with COVID-19, he's saying you don't need the vaccine, right? No,
that is the contrary. Even from the start, we believe that after the infection, you should get a vaccine. Now, previously, we thought you have natural immunity for at least 90 days. However, now there's growing evidence that you should get it as soon as you can, especially after your infection, your recovery is going well. You should get it as soon as you can.
Well, Bill says this, Dr. Gwynn. He says Delta didn't show up until the vaccines were produced. The more people that get vaccinated, the more Delta cases. It's not hard to put 2 and 2 together. If 50% of the country is vaccinated, why are we seeing a spike?
It kind of goes into that same question we had earlier about when the Delta variant came, into the world, as well as when the mass vaccinations occurred. Again, what we weren't aware of is the high transmission of the Delta variant, the high viral load that a person can carry. That is what's causing the person-to-person transfer, regardless of vaccinations or not.
Another one here from James. He's asking, will these vaccines alter my DNA or insert a microchip?
No, that's another myth, and there's absolutely no evidence that it will alter your DNA. And as other vaccines, it will not lead to any long-term consequences or any future offsprings as well.
What are some of the other common questions that you're getting from people in terms of myths? I mean, you know, we hear a lot of the information, but what are you hearing most in terms of the myths and misinformation?
Misinformation such as, you know, does it cause you to get COVID? And that's certainly not true. Does it cause you to, you know, have problems with other infections? And that's absolutely not true. What I do try to dispel is the concerns that people get gravely sick. And I can tell you, I know many, many people that have gotten the vaccines, including my entire family, all the way down to my 12-year-old, and none of us have gotten sick. So I highly recommend it.
All right, Dr. Gwynn, thank you so much for your time and your expertise. We hope this question and answer special for all of our viewers has answered a lot of your questions about the current state of COVID-19 in our community. And by the way, for continued coverage and more resources, right now you can head to fox26houston.com. There we have the latest information. Just hit the coronavirus tab.